When you or someone you cherish, your partner, your child, your parent, is in the hospital and it's 3 o'clock in the morning, and they're in pain, or they're struggling to breathe, or they're frightened, and they put on the call light, they push that button for the nurse to come to take care of them. And they push that call light for the nurse to come to help them. And they push that call light again for that nurse to come to help them. And that nurse is struggling to get to that patient, but is also struggling because they're also assigned so many patients that they're pulled in so many different directions. That's what ballot 1, question 1 is all about. It is about being able to take care of people that are in the hospital by setting a safe limit to the number of patients that are assigned to a registered nurse at one time. So when you or your loved one is in the hospital and that call light goes on, that we can get there in time and limit the distress and the pain of the very patients that have been entrusted to our care. There is a lot of opposition from the other side. There are TV ads that are meant to do nothing but to confuse people about what is the right side of this argument. The opposition has spent over $10 million in ads to confuse you, to confuse the voters on how important this issue is. And if you look really closely, it almost resembles union busting. Getting in there and confusing the issues and scaring people. Well, I don't want people to be scared anymore. I don't want the people that I am told to care for, that I am responsible for caring for, to be frightened anymore. I and my fellow nurses and everyone in this room have to stand up and fight back and vote yes on question 1 for safe patient limits